everybody and welcome to the Physio Quest. Our mission at Physio Quest is to bring together all the leading practitioners and experts in the field of physiotherapy. We intend to bring a change in this world by making people aware about different problems which can occur during the physiotherapy, the cases in which you need to go to the physiotherapist, and the solution and the approach. And in this road today we have as a guest Dr. Pradeep. Dr. Pradeep has done his masters in physiotherapy. He has worked with a lot of hospitals and different healthcare sectors. He has an immense experience in this zone. Currently, Dr. Pradeep is heading the Varsha Physiotherapy and Healthcare. So guys, help me in welcoming Dr. Pradeep.
Does patient require doctor referral for coming to the physiotherapist?
Not really. See, 90% of my cases, 95 cases of my cases are direct walking to the physiotherapist. Okay. But see, it all depends upon that quality and experience of the physiotherapist. So if he asks me like a graduate who has just finished his graduation and he has started a clinic, then I will really not suggest. No, he can take the patient directly. He can take it to the doctor. Because it's all, after all, it affects the quality of our treatment. See, we are in a service industry and we are dealing with human beings, and our diagnosis and our treatment depends upon our diagnosis. And so initially, as a graduate who don't have a good experience, my recommendation will be the patients can go through, or the doctors can recommend patients to him. But once maybe a postgraduate or with a good experience, maybe a graduate with 3 to 5 years of experience, or a postgraduate with 2 years of experience, my experience is they are good enough. It doesn't matter whether they are postgraduate or a graduate. What matters is their experience and how well they are able to apply the knowledge to diagnose the condition. Okay. So it doesn't matter the way. So this is what the criteria I find for seeing a patient directly. Okay.
Okay, sir. And sir, one more thing that many patients are confused with is that, that when they have certain kind of problems, so should they go first to the orthopedics and then come to the physiotherapist, or what are the conditions which the patient can come directly to the physiotherapist?
See, there are many of the conditions, okay, except if it is basically about, if the public, it is about the public awareness of the physiotherapy field. Suppose a simple backache, a knee pain, any kind of any aches and pains which doesn't have much of a traumatic situation, okay, which doesn't have much of a traumatic background. The patient just got up in the morning and got a pain on the back, or the patient is something which doesn't have much traumatic background. The patient can directly come to the physio. But see, even though we can talk in between two physiotherapists during interview, it's all about how well public is aware about what the physios are capable of doing. So it's more, I feel it's the public awareness. Okay, this is a condition a physio will be. What is a physiotherapist and what he can do, and what is a doctor, and when I need to go to a doctor. Okay, so this thing, even this is still, and even in metro like Bangalore, I'm from Bangalore, there are still confusions among public that whether I can go directly to a physio or I should go through a doctor. In case there are many patients who come to me, they said, no, doctor has told not to take physio. He said just to take the medicine is more than enough. And I have insisted, the patient used to say, I insisted, doctor, no, I would like to go for a physio. Then the doctor directed me to a physio. Here, the patients are also confused, where to go, how to go. So the confusion can be removed by a proper awareness among the public. And it is much better in cities like Bangalore, Mumbai. I worked in Cochin and I was in Mumbai. Now I am in Bangalore. So much better in metros. Yeah, but in villages the situation is very it's developing, or it will take some more time. Okay, I'm also from a village. Basically, I'm from a village. So when I go to my native, I know. When I visit different hospital to see the condition of physiotherapy department, how they work, there the situation is entirely different
Correct,
from
sir.
what we are practicing in metro.
Correct, correct.
So it's basically if you can aware, public. See, in Bangalore and all, there are many awareness program like during any international day, like International Parkinson's Day or Women's Day, or some any such clinical day. They physiotherapists conduct some camps, so that the patients can come directly to the center or to the camp and see what the physios are capable of doing.
Correct,
And
correct.
that way I think Bangalore or the metros are much the public awareness is much better. And one among the public, the group which are very well uh, uh, aware of physiotherapy is the sports guys,
Correct.
not necessarily the real athletes or the real professional guys. Those people who are doing sports as a hobby, like in Bangalore is an IT hub, so most of the IT guys are into running, jumping, or some kind of cycling. They are well aware of the physiotherapy and its role, so that population among the public come quite directly to the physio. And
Correct.
no, that's what I see here.
So, sir, for example, when the patient comes to you for the first time,
Mm-hmm.
how do you go about devising the plan for him? So, what do you see initially while the patient comes to you for the first time?
How do I plan a treatment?
Correct, sir.
Okay. See, okay. So it's all depend. As I told, in general, I can say the patient goes through an evaluation. The first visit to me is basically is an consultation visit. I don't start treatment in the first session. Okay,
Mhm.
so there will be a proper consultation, there will be an evaluation. Based on the evaluation, I tell the patient, see, so if the patient is coming with a knee pain, okay, so the
Correct.
patient is coming with a knee pain, so the patient might be coming with a lot of documents related to the knee pain, either X-ray or something, whatever it is he's bringing. So I collect the data initially from the patient. Once I collect enough data, I take the patient for examination.
Correct.
Once I'm through that examination, I find out. Okay, I find out these things I can see from the biomechanical point of view, from the structural point of view, from the local site of pain, and I try to correlate, right from whether it is knee pain, what is the relation of hip to it or the relation of foot to it, and locally in the knee, what all the structures, what could be the structures affected. And once I collect the data, then I make a treatment plan, or I make a short-term plan. Okay, very short-term plan. Initially, if the concern is pain, my short-term plan will be to manage the pain, and I explain the patient. See, these are the things. Actually, the problem may not be if the patient also still comes with the knee pain. I tell them the exact cause of the problem is that the knee is being overworked because of some compensation. So we have found problems here and there, and as
Mhm.
we correct the real problems, now maybe mostly you may get out of this knee pain. So we will very thoroughly explain the situation to the patient, and we'll tell them these are the things we are going to do for the first 3 days, 3 to 5 days. Okay, not really 3 days after 4 days now. So we
Correct.
just give them a time frame. Okay, within 3 days or 4 days, if the pain and inflammation or the things which we are looking as a short term goal comes down, then we go to the next stage. And
Correct.
so we explain the things. Okay, how long? So most of the patient, their first question is how many session I need to take.
Correct.
So again, it depends upon the condition. I tell them, okay, a minimum of 10 to 12 days. So again, I tell that 10 to 12 days is not a fixed date. If you are all right, in sixth day of physiotherapy,
Correct.
then we will not continue on a regular basis. Like we will be meeting once a week, once in 15 days. So again, the frequency of treatment all depends upon how well you respond to my treatment. So I'm
Correct.
giving some input to your body, and I expect your body to, the output. What I'm expecting is your body has to respond to my treatment. Each
Mhm.
body differs. Some body respond in the day one itself. Some body takes 3 days, and So based on that, we decide the frequency of therapy. So I see first day is always first day is just consultation, and all these things are very well explained to the patient. Once the patient is convinced, okay, this is how the treatment plan is going, this much time it may take, this is the number of days I have to come, and this is how it goes actually.
Okay.
Okay, and we always have a record of the patient, a proper record we have.
Okay.
So that in the initial days, what all things we did, and the second phase of physio, what all things we did, and when the patient comes in the future also we have. So it goes like that.
Okay. So, sir, while there are different techniques in the physiotherapy, like, joint mobilization and joint manipulation, so what do you think before applying these techniques, do doctor need to take a consent from the patient that I'm going to do this thing? Or is it a responsibility of doctor to make people understand that this technique would lead to this particular kind of thing? Is it required in this scenario?
Rather than consent, it is the duty of a physiotherapist to explain what he is going to do is on his body.
Correct.
See, it is something like a surgeon who is putting the knife inside the body. We are putting things over his body.
Mm-hmm.
Okay, when the surgery is done, he takes the concern that I'm touching your body and I'm going to do something inside your body. Same
Correct.
way, we are going to do something over the body. After all, I'm going to touch his body. Right?
Correct.
There is a physical touch. So definitely to touch a body, we need a consent.
Mm-hmm.
Okay, so in the consultation time itself, in the beginning time itself, the physiotherapist should explain, see, this is my mode of treatment and I'll be doing mobilizing. So I have to hold your body. Sometimes you have to come with the shorts. We have a changing room. You can change from here during the treatment. Some dresses won't be, we won't be able to treat how comfortable you are in shorts, especially if there are lady patients, we have to explain. Suppose if there is something like lymphedema, and the therapist has to do some lymphatic drainage or something, so it has to come to the shoulder. Sometimes it has to come to the chest region. So we have to tell. So this has to be done physically on you, and are you comfortable with that? And we have to explain the procedure, and whatever it is, whether it is manipulation, mobilization. Then we just need to see. Basically, I'll tell you 95 to 98% of the patient won't say no, but they will be rather happy if we explain the procedure to them. So that they are confident, so that when they come for the session, they are mentally prepared. Okay, this guy is going to touch my body. This guy is going to do this procedure on my body. He has already explained to me, so that there is no doubt. Okay, he hasn't told any of these things. Now he is
Correct.
So we have to make a very good rapport, telling clearly what we are going to do with the patient, whatever it is, whether it is any part of the body, whether it is hand to the any part of the body. It is very important to inform the patient, explain it. That itself is a consent.
Correct.
Okay, we need not have a consent which
The
is
consent, correct. Mm-hmm.
Yeah.
So one more thing that I want to understand is that we see that nowadays a lot of students are coming out of college and opening their physiotherapists, the clinics. So a new doctor which is coming out of the college, what would you recommend, that which are the basic equipments which are required as a physiotherapist? For example, like do they need to have a EMG machines? Is it required at all? So what do you think are the prerequisites, before opening a clinic?
The prerequisite before the best instrument a physiotherapist should have is knowledge and experience.
Correct.
It's not at all the modalities which is going to give a relief to the patient. Suppose, my experience with my juniors is when I tell them, okay, person has come with a sciatica, when I tell them, okay, just keep the IFT, whichever way and they keep the IFT, they know to keep the electrode, but which is the structure where they are keeping, which structure they are keeping the electrode. So they just keep it over and they just switch on the machine and they go. But tell me, which is the structure under, what are the structure which are covering these electrode?
Correct.
So it's basically the knowledge. So, and same way, when I ask them to do an ultrasound, okay, they just give, so they just do some, they just talk and they look here, they listen, they open their mobile and do. No,
Correct.
it's not about the modalities. They should know what structure they are working on, whether they are doing the ultrasound on the ligament, whether it is on the capsule, whether it is on the muscle, or if it is on the muscle, how the muscle is located on that body part. So
Correct.
my movement, how the my movement should be. So
Mhm.
even though if they are well equipped physiotherapy center, or if they are having the minimal equipments like an ultrasound or IFT or a TENS, uh, it's the application of that instrument. Otherwise, nothing will work. Whether it is the imported no Chattanooga instrument or the Indian
Correct.
instrument,
Mhm.
it doesn't going to work. So I might always, when I take a new assistant, at least I take 3 to 6 months to train them. When you do so the basic thing, they should know what they are doing on the body, which structure is under treatment, whether the capsule is under treatment, whether the ligament is under treatment, whether the muscle is under treatment, and how the muscle is located in that particular part. What is the direction of the muscle, direction of the ligament,
Correct.
direction of the tendon. And so that the treatment, even we can do wonders with simply with ultrasound and sciatica. We don't need hi-fi equipment if the guy is very, if the physio is very confident in what he is doing. Suppose a piriformis syndrome, he just need to select what frequency, like no, whether it is 1 megahertz or 3 megahertz, or
Correct.
which know how to find the depth of penetration, and how the
Mhm.
piriformis from where to where this guy, how to identify, isolate the piriformis by doing the movement, palpate it. And if we do ultrasound, we get it. I'm not saying ultrasound is everything will do. I'm just telling it's not about the equipment, basic equipments. It's about how the physiotherapist has a his knowledge to use the instrument.
Correct.
Okay, and coming in, I'm now really answering your question. The right the answer. I mean, what I mean is, this is what is basically required for a physiotherapist, because many, even the physiotherapist can work without any of these modalities, neither
Correct.
ultrasound nor IFT, nothing. If he knows what is the problem, he can work. Many of, not always, many of the time. Even simply with an ice pack, also he can ice pack, and a hot pack also. With a proper knowledge, he can manage.
Correct.
But okay, though. So, but even if he is starting a clinic, he should have at least no ultrasound and all kind of currents, like especially IFT and TENS. I sometime, any of the times I recommend IFT to TENS, because of the current is little more soothing and
Correct.
penetrating nature than TENS. Then ultrasound, diathermy, it depends upon the belief of the therapist or no knowledge. It all depends upon the knowledge, but not
Correct.
necessarily diathermy should be there. But basically ultrasound, if they have an IFT machine, well and good. I don't, then basically they should have all kind of they should have a place dedicated for the exercise, a room which is just made only for doing exercise. Like there can be a therapy, there can be therabands, uh, there can be a medicine ball, there can be a physio ball, there should be mats. Of course, there should be exercise mats. It's a yoga mat or whatever it is. There should be mat, and there should be mirror, no doubt about it. So these things are enough. So most of these things are enough. Okay, I don't see. Basically, the patient, to my experience, we just need a 10,000 to start a basic physiotherapy department. Okay, so to buy the therapy, to buy an Indian-made TENS machine or IFT machine, ultrasound machine, and maybe one or two couch, maybe 10 to 15,000. Okay, so he can start a basic clinic, but he should be very well equipped with his knowledge. At
Correct.
the end of the day, none of these equipments are going to help him to uh, uh, cure any disease. It is his knowledge,
Correct.
his confidence, and more than that, so what he does to the patient is not how confident he is. So each time when a patient talks, he can make out the patient. See, most the patients are not idiots, right? They
Correct.
would have already went to 2 or 3 physios. Many of the patients do that. They simply
Mhm.
visit 2 3 clinic to find out who is the right guy. The
Correct.
moment when we talk to the patient, then okay, this guy knows my problem.
Mhm.
He is guiding me properly, and he is talking sense.
Correct.
No? So this also patients observe. Many of the patients, no, some of the patients just take whatever we say, but many of the
Mhm.
patients, especially in metros, they are quite intelligent to understand what this guy is talking, and
Correct.
whether it is going to solve my problem. So the therapist should be very well equipped with knowledge, and that knowledge will usually reflect in his way of conduct, and then the basic instruments will help him basically.
Correct. So, sir, for example, when the patient comes with some chronic, injuries, then maybe it may get recovered within a week or two. But what about the patient who have such a disease like Parkinson, which takes a long amount of time to recover? So, how do you keep track of, the progress? How do you keep track? How do you measure that? Okay, these are progressing, their strength is increasing, with time.
See, any progressive neurodegenerative conditions, okay, any neurodegenerative condition, suppose like as you said, told Parkinson's, or whether it is any other kind of neurodegenerative conditions, we know
Correct.
the basic nature of the disease is to progress. Okay,
Mm-hmm.
so the basic nature of the disease is to progress. So, the progression is at the physiological or at the cellular level. Okay, so there are some biochemistry or biochemical factors which are gradually progressing the disease. Either it is a gradual deterioration of the cellular cells, or it is a gradual accumulation of some kind of toxins which is gradually deteriorating the condition.
Mm-hmm.
Okay, so in one side of the body, this is gradually happening, either the cellular degeneration or the accumulation of toxins which are causing the disease condition. On the
Mm-hmm.
other side, we are working, right? We are working on the physical aspect of the problem. We are trying to improve the strength, we are trying to improve the balance, we are trying to improve the coordination, okay,
Correct.
over a period of time. See what happens if the patient is not being thoroughly taken care of his biochemistry and the things which is degenerative changes which is happening in one side. Maybe he has to, if he's not taking a proper medical care, like it is the duty of physiotherapists to tell him the importance of taking medicines on time, and how follow up with his own doctor, especially in case of neurodegenerative chronic conditions. Okay,
Correct.
sometimes it is the duty of a physiotherapist to tell the patient that he has to keep a track of the his biochemistry, or he has to meet his doctor on a follow-up basis, or his bystander is making sure that he is taking medicine on time. Then,
Mm-hmm.
if that part has been done, then physiotherapists, whatever physiotherapists start as a program, may start reflecting on the patient over a period of time. So now, to how to see, in most of the neurodegenerative condition, it's a chronic condition. It takes a very long time, sometimes months or
Correct.
years, because as we know, the nature of the disease is to deteriorate over a period of time.
Correct.
Maybe we will be able to reduce the pace of deterioration, where we may not be able to arrest the deterioration, because as I
Mm-hmm.
told, the cause for see, in case of a back pain, we work on the cause and we take the patient out of the back pain once for all, because we are working
Mm-hmm.
on the cause. But
Correct.
here, in case of neurodegenerative condition, we are not working on the cause. We are
Correct.
indirectly working on the brain and the nervous system to activate the with the various programs, whether you call it an NDT program, whether you call it a PNF pro patterns or something. We are indirectly approaching the nervous system to remain active, to be more productive, so that the rate of degeneration comes down over a period of time.
Correct.
Okay, so one thing, most of the time, what I do is I either train the bystander, whoever is coming, or whoever is whether the bystander or whoever is coming, and
Mm-hmm.
make sure that this bystander is making this person doing exercise once a day, and
Correct.
once will be with me, and once will be with the bystander. As
Mm-hmm.
I feel the bystander has learned almost all set of exercise, so I am making a 5 set of exercise. Like, and I am dividing, like, Monday, Wednesday, Friday, this set he will do. Tuesday, Thursday, Saturday, another set he will do, depending on
Correct.
the target. Okay, we have a target. Like, see, especially neurodegenerative conditions, since it is seen in elderly people, we cannot put them on a lot of exercise program. We have to
Correct.
make a proper schedule and give it to the therapist or give it to the bystander, and and either like every 15 once in 15 days, and we call the patient and talk to him and see and just make a small quick examination, and we can make out, oh, the guy is gradually improving or he is deteriorating. If it is deteriorating, is it from our side, whether the bystander is not doing exercise on time, or what is the problem, whether we can correct it from our side, or whether it is the biochemistry, like as I told, the pharmaceuticals are not being given properly, or he's not doing follow up, or some other things are so if it is within our framework, we can correct it. And sometimes certain things we have to simply direct it to a proper physician. We have to go and meet and do it. So we also have a very good role, not only in the just to do the rehab, but direct them where they have to go, and what they have to do, whether which doctor they have to go and meet and talk. So that also we physiotherapy should aware where we have to guide this patient next, so that he may progress or he may get some benefit. It's not like we cannot just I feel we cannot just say, no, it is not in my hand, no, I cannot do anything. You can just try something else. But at least we should have enough knowledge and experience to guide what can be done next. See, the patients are also desperate, right? They are coming to you for a solution. Whether you may be able to give a practical solution in the form of a physiotherapy, sometimes you will be able to guide them through your knowledge that you may try this, or you may go to this doctor and you may try that, and you can that I feel especially in, so one thing is you can make a schedule of the exercise. And one major thing what I do with neurodegenerative conditions is I handle a lot of spinal cord injury cases. So I make sure that when I make the protocol exercise protocol, the bystander, whoever is there, I make him a video of all the exercise. I make sure that the bystander is taking the video of all the exercise. So I make see, sometimes my program will be 2-day hands-on training for the bystander. So I call the so that's 2 days I don't see any other patient. I just call them to my clinic. Morning 10 o'clock I start, and evening 3 o'clock it will end. Then again next day 10 o'clock to 3 o'clock. These 2 days are exclusively for that spinal cord injury patient. And in these two, I make the protocol, I do the treatment on the patient, and I make sure that I soon after I do the exercise, I ask the bystander to do the exercise on the patient, and as during the third person will be recording, or the bystander will be recording when I am doing on the patient. So make sure that the bystander is very clear, because most of the time bystander can be a layman. So make sure that the movements he is making on the patient, or making asking the working with the patient is correct, that it is up to the mark, that whatever exercise I have taught or I gave and demo, and make sure that the bystander is doing. So once the bystander is very clear about more, so they carry on. And how I keep a track on diseases, I have patients from Kuwait, Malaysia. I travel Kuwait and Malaysia very frequently. So when I go and teach either the therapist or bystander, I come back and we have a video call, like every 6 months or every 3 months, or so it depends upon how frequently they need. So I keep a track on things, and I insist that this time they have to call me, and any doubt, any period of time they can see. Nowadays the communication is not at all a problem. Even they can say, sometimes even they don't want to, I tell them, you just send me the videos, all the videos what you have been doing. If the patient is outstation, is not in the station, or the patient is not in Bangalore or outside India, just tell them, just send me the videos what you are doing. So they can share it through my WhatsApp, they can share it through Messenger. I just go through it and see. And these videos I take a note of, this is what is happening. Then we make a video call and make sure that these videos, these are the things he is doing right, these are the things he is doing wrong, and correct it. See, nowadays even treatment through online treatment is also possible, which I have been doing since very long time. Long time I've been doing. So we just need to know how it is to be done. Everybody can do it, but we need to know, because it's more about communication, right? Treatment is when a patient comes to you, you communicate with the patient directly on the patient. But when it is through here also, there will be a lot of communication gap. So how you need to think how you can fill this gap, so that the patient get the whole picture of what actually I mean. It's possible actually. Yeah, we can actually keep a track of everything. the progress, the deterioration, and we can do.
So, doctor, the question which arises in my mind is, while we are giving a bystander to certain patients, or maybe you are recommending some certain exercise. So, is there some mechanism to have the quantitative, analysis? Is there a certain mechanism right now in this ecosystem where we can have a quantitative analysis of, that this much is the recovery, or this much should be there?
See, definitely we should have, and see, we are doing a treatment to get some progress, right?
Correct, correct.
We are doing some treatment to get a progress. So the most important part of the treatment is to make a short-term goal. Suppose a Parkinson, so I can tell you more with reference to spinal cord injury patients than any other neurodegenerative condition. Suppose a patient, okay, spinal cord injury patient who is not able to sit alone, okay, who is in bed. So the spinal cord injury patient required a support of an bystander so that he can come to sitting.
Correct.
Or so as I evaluate and as I understand, the patient do not have any trunk control. Okay, so thoracic level patient doesn't have a trunk control. Okay, so and I evaluate and we make, okay, so I talk to the patient, what all your concerns, what actually you are looking for. If the patient is telling, if suppose if I can sit independently, it will be it will be a big thing for me. If the patient himself is telling, so we can actually understand what the patient is thinking about his condition, and that can also help us to make a short-term goal. That is what the patient desperately looking for. Just, I need to sit. Okay. So, okay, now after evaluation, I just, after evaluation, just hold on, okay.
Of course.
After evaluation, I felt, okay, the immediate short-term goal is the patient just need to sit. Okay, so I just need to make an exercise strategies. By doing that, the patient is going to sit maybe in a 3 months time or a 6 months time, or minimum of or I can say a minimum of a 3 months time or maximum of a 6 months time. Okay, so here we need to understand what is not allowing the patient to sit. Okay, and what, by doing what or by making what, we can make the patient sit. Okay,
correct.
So it may be, we can so it is actually a set of protocols I developed to reach a short-term goal.
Correct.
So it is very, very, very important to make a short-term goal, especially in case of neuro cases.
Correct.
Because we cannot achieve the final goal in a period of time frame. And another important of short-term goal is the patient's confidence increases. Suppose the patient was not at all sitting alone, and within a 3 months to 6 months period of time, the patient is able to sit independently. Then the patient has gotten confidence. Yes, therapy is working. Whatever exercise I am doing day and morning and evening, it is helping me. I am progressing. But otherwise, if we don't make it, the patient, the confidence increases to stick on to the program, stick on to the therapy program. Otherwise, say, no, I tried physiotherapy here, I tried physiotherapy there, don't know, nothing has been happened. So what is practical, we have to explain to the patient. If suddenly a spinal cord injury patient say, I want to walk like before, no. There is an actually a practical thing which we can bring to the patient, and there is something which is ideal the patient want to become. So how well it matches is important. So I use a term called maximum level of independence. So by evaluating, by understanding, by examining you, I feel that this is the maximum level of independence is possible at this period of time. I will not make a full tag that this is the end of your maximum. Suppose after evaluation you will be just able to sit and nothing else is possible. And that itself is going to break the confidence of the patient. So we will see right now by examining, this is what I feel about you, and this is the maximum level of independence. In 3 to 6 months period of time, we will be able to sit. Once you are able to see, in fact, what happens, the neuro recovery, especially in spinal cord injury, doesn't end. There was a belief that there is something called a plateau stage, where when the patient reaches a plateau stage, nothing is possible. No, it's nothing like that. So the moment you reach a goal, then see, you reached a goal by following certain protocol, and you made
Correct.
sure that that protocols are specifically to achieve that goal. Same way, when the goal has been achieved, the next immediate goal, what is
Correct.
the next thing we can achieve in that patient, and what are the strategies we can develop to achieve that. So this is how I have been working with many patients and still working, and no, I get a very good response, very good. No, I have a professional page in Facebook, and
Okay.
you can see the many of the reviews of the patients, how they have responded. Especially, I'm doing an there is an spinal cord injury home recovery solutions. There is a SCI home recovery solutions
Okay.
page in Facebook. So basically, we can do a very good job by tracking the progress. Uh, we can do a very making short-term goals and make sure that it is working. How well
Correct.
you develop the strategies, how well you bring the get the confidence of the patient. It's all in the hands of a therapist.
Correct.
Yeah, that's what I feel.
So, sir, how do you think that how important is the technology in the physiotherapy field? And to make your work easy, what kind of technology would you be requiring? The technology which could measure, for example, the range of motion, or which can example, a smaller version of the EMG. What kind of technology are you thinking of?
See, technology is making a huge impact in physiotherapy treatment as well as in diagnosis. Okay,
Correct.
huge impact. Okay, for example, one technology I can say, an foot plate or an pressure plate analysis, or the no, it's called pressure plate or a foot plate. I mean, what do you call it? You can call it a gait analysis. Okay,
Okay.
in gait analysis there are many advanced things are available where you can find the pressure distribution of a feet. Okay, suppose if I make the patient stand on a pressure plate or an sensor or a mat with a lot of sensors, in the computer screen itself I can see how much load he is putting on the right leg and the left leg while he is walking on the mat. Okay, the sensor mat, I can see how the propagation of the weight, how the propagation of his weight is getting distributed through his feet, and so we can get a very detailed data of his progression, his very detailed data of how he is walking and what are the components. No, gait analysis I found a very effective tool in correcting many of the runners, in correcting their running technique, in avoiding many of the knee injuries, shin splints. And in many ways, that is one of the thing. One of the second thing is virtual, virtual training. In many of the occupational therapists are doing for autistic kids to get their attention span, and in even virtual training is being used in stroke recovery.
Correct.
So that we get the attention of the patient. With the whole idea is how actively you can participate the patient in the program.
Correct.
So the technology helps in a diagnostic way, like as I told, gait analysis. The technology helps in therapeutic way. Um, so technology is playing a huge role. And you see, in nowadays, the robotic technologies are also coming into the physiotherapy field. I use a lot of weight harness for training the spinal cord injury patients. So now I keep updating myself about the robotic things which are happening. So recently we are trying to contact the Honda company in Japan to get a small robotic device which can support the hip joint of a spinal cord injury patient. The patient has got a very good strength, but the coordination is lacking. But this, what this robotic joint will do is a small exoskeleton. It's not a huge exoskeleton like HKFO. It is
Correct.
just one hand length which can be fixed to the hip joint. So it just controls. It can sense the patient. Okay, as the patient makes an 20% of effort and the 80% is required, the machine can do. Or the patient is doing 80%, the machine is need to do only 20%. This
Correct.
robot can sense it. So technology is really helping in therapeutic ways. See, right now, what I could understand, even there are some physios outside India, especially, they are doing ultrasound guided dry needling.
Correct.
Okay, so we have reached that level of no treatment where it is going to be so precise, and it is going to be document also which structure we have needled and whether it is entering the right area.
Correct.
Technological advancement are very much in India also it is happening, but very few therapists are able to make use of it because of various reasons. One is the basic knowledge of these technologies which are being taught at the college level.
Correct.
None of the physios, when they come to the hospital, they get a training. Okay, the hospital has got that equipment, and they get trained in that. And very few physios are able to make use of the technology. Okay, but I feel if we can start, if there is something in the college level, one of the most important subject is the technology in physiotherapy. That itself can be taught as an subject.
Correct.
Because there is technology in neuro rehab, biomechanics, pediatric rehab. So this technology has to be taught as a different subject. There is a scope for simply teaching them as a subject.
Correct, correct. Because very recently we went to Hyderabad 1 week ago and we interviewed a startup. So that particular company is working on a biomedical device which can, measure the range of motion and the strength, because they have collaborated, an amalgamation of an EMG machine and, the range of motion, which can measure. So they are working on that device, which can help to measure the both range of motion and the strength of the patient. So how do you think that that device can be useful to you as a physiotherapist, and how that can have an impact on, the ecosystem?
See, it's very difficult to comment on that device because without knowing the device properly, if I say something comes as a negative point from me or a positive point from me, either I might be propagating the device or I might be putting my own ideas to put the device down, because I have not seen the device. I don't know the specification of device. So it will be very difficult to talk in favor of the device as well as to negate the, because I really appreciate all kind of innovations which are happening in the physiotherapy field.
Correct.
All kind of innovations, because we need innovations, we need
Correct.
technology. It's not like that, okay, this is something new, different, he has got marketing strategies, he has going to sell the device. No, that may be a different thing, but
Correct.
how effectively it is going to help you in your clinical and research. Because I'm a guy who has developed a device called shadow goniometer. So goniometer is basically, it is used to measure the joint range of motion.
Correct.
So I had developed a shadow goniometer to find out the proprioceptive acuity. So during my post graduation, I need a device where I can find out the joint sensitivity, basically proprioception. So I need to import a device from US which was going to cost dollars. Okay, so it's basically an isokinetic device which I need, which can be used for even that device can be used to find out the proprioceptive acuity. So it was going to cost me dollars.
Correct.
So I have to develop a small device and I have to do a pilot study on that device. Then again, I have to do the main research on the device. So if I don't come up with an innovation, if I don't come up with my research wouldn't have been possible.
Correct.
And, so all these things, the technology development should happen in the field of physiotherapy, should be tested, and it will be tested by physios. And there comes a point as it is, we can take that device into our field. And there are many devices has come and gone. Many such devices has come up with very beautiful colors, but when we start using it as it doesn't have much role. We keep it away.
Correct.
So like the EMG device and with a combination of goniometer and EMG device seems to be a very good idea, where they can measure the strength, measure the range of motion. Seems to be a very good idea. Let us see, once we use it, we will be able to comment it on.
Correct.
With a realistic comment can be given on it.
Correct, correct. And so one last thing I want to understand from you is, what do you think currently the main pain point in the physiotherapy system in India? What's the main concern of the doctors in the physiotherapy system in India?
Okay. See, my main concern about the physiotherapy field you are asking.
Correct. Yes, sir.
The field, right? So my main concern is the average knowledge of the physiotherapist who are coming out from the college.
Correct.
Sometimes some physiotherapists, I don't know whether I should say some or majority, but whenever it comes to the juniors, okay, when juniors in the sense BPT guys, I'm telling, whenever they
Correct.
come out of the thing, it was so surprising for me. They don't even come up with a basic anatomy knowledge, basic biomechanics knowledge. So I know it will be very difficult to work in our field with a basic knowledge. So main concern is only their basic knowledge about the physiotherapy or the knowledge about different anatomy or physiology. Our physiotherapy field actually,
Correct.
different subjects, and especially one subject is anatomy and biomechanics.
Correct.
Whether they don't know microbiology or physiology doesn't matter to us. So when I
Correct.
say I need to stretch the piriformis, and when this guy do some other stretch, I feel okay. This should not be. So main concern is the mediocre knowledge of a graduates who are coming out of the college. There are various reasons for it. Okay, there are colleges which are running on distance learning also, that I'm
Correct.
not going into. But
Mhm.
as a concern, one thing is the mediocre knowledge of the physios or the graduates,
Correct.
because when they work in a system, when they work in an hospital, the patients who go and talk to them, or the doctors when they go and talk to them, the impression what they develop about the entire physiotherapy field
Correct.
matters to us. That is
Mhm.
one thing, one concern. Second thing, concern is the entry of different other field into the field of physiotherapy, like osteopathy, and many other things are entering into the field of physiotherapy, which it is creating a lot of confusion among the public.
Correct.
Like there are osteopaths, and there are many other kind of things, like
Like wave
visceral
acupuncturist, the
manipulation,
people.
many things. See
Correct.
what happens. It creates a bit of confusion among public, as well as especially among public.
Correct.
What is this physiotherapy about? Is it about treatment with exercise and modalities, or is it something to do only with a manipulation? Because some physiotherapists put themselves as a manipulation therapist, and they say, I don't use any modalities.
Correct.
I just manipulate the spine and correct everything, as if they
Mhm.
work as an osteopath. They see, it's not wrong. There is nothing wrong in studying different field, whether it is osteopathy, whether it is craniosacral therapy, visceral manipulation, whether it is nutrition or whatever it is. But our basic nature has to be maintained, though we are using the other thing. As a physiotherapist,
Correct.
we are a physiotherapist. We have an identity.
Mhm. Correct.
We have an identity, and we should make sure that that identity is maintained throughout our treatment process. During a treatment, I leave my entire identity. I become an osteopath for one patient. I become a manipulation therapist for another
Correct.
patient. No, we should be a physiotherapist, and we should be proud of it. And of course, we should be able to use the other knowledge so that the treatment becomes more effective.
Correct.
Okay, but no, when the therapist boasts themselves as an osteopath, I'm an osteopath also, it need not be. The
Correct.
physiotherapist itself is enough to take care of everything, but the knowledge of osteopathy is good. Knowledge of some other manipulation is absolutely good. But he should not have an identity crisis, whether he is doubtful whether I should call myself as an osteopath, whether I should call myself as both physiotherapist and an osteopath.
Correct.
That thing is also another concern which is happening to me. Um, then other concerns are the quacks are there in our field, where many times. So recently I visited some places remote in Telangana, where I went and treated a spinal cord. I went for training, hands-on training of the therapist. In fact, so when
Okay.
I dealt so-called physiotherapist, but when I went and when I was talking to him, I could make out, no, this is something wrong.
Mhm.
I think so, but I don't need to. But by my idea is to go and train there. Somehow I could train the person who is taking care of the patient, but I
Correct.
could find, okay, there is something wrong. I cannot make he's, and I cannot take he's a physiotherapist actually. So
Correct.
So there are things are happening like that. Some massage therapists are working as a physiotherapist. Recently one patient came to me and saying that he is a physiotherapist. And I asked him, so he's a quite elderly person. So respecting his age, I didn't ask, but I just asking. So then he told, I do acupressure. I have been treating a lot many patients, and
Okay.
I'm also a physical therapist. So when I asked his qualification, he finally told I am an acupressure therapist. No,
Okay.
so this happens. They call, they tell themselves an acupuncturist and all. So, so it also created confusion among public. That is also there. And the another concern is the doctors which are unnecessarily getting worried about the physiotherapy field. That especially orthos, they feel that we are being competent to their thing. That is another concern. In fact, it is not that physiotherapist know what he is capable of, and an ortho know what he is capable of.
Correct.
So somehow, even in my own setup where I work, my clinic is attached to a diagnostic center. I have rented a place, and I am running my clinic from there. There are many doctors come consult and go, including orthos. So when patients come and tell, see here the ortho don't recommend physiotherapy, but I
Correct.
saw here, I can see a board here and I can see so I came directly, walked in. And no patients, when the patients come and tell no, the orthos are not really recommending, it's a concern because we are not a competition to them. We are working from a very scientific background, and no, this is another concern which has
Correct.
to be handled properly, maybe with a proper communication. Somehow I didn't do it personally, going to an ortho or going to a doctor, asking for patient, and I'll give you a 20 percentage of my this is the usual thing. Okay, I'm just talking about this is what happens if you go to a doctor and tell them you're a physiotherapist and you need a patient, refer me. They will ask you 10 to 20 percentage. Somehow till today, by God's grace, no, I need not go to any of these doctors and sharing a cut with them. So I feel that is not the way to get the patient, but it is also that also happens. I'm not saying it is. It happens. Okay, everywhere it happens, but somehow I need not do that. Somehow I am getting patients, or I don't know. But this giving a 20 percentage to the doctors and getting patients referred from them, I really don't. So because somehow playing with the playing with the patients. Poor patients, they are not knowing what is happening between the doctor and the therapist,
Correct.
and why the doctor has been recommending to particularly to that physio. When I say I have
Correct.
a myophysio near to my house, no, many things happens, right? When the patient comes, we can understand many such things. So today itself, one patient was telling, no, I work. So your doctor has recommended an physiotherapist near that Chinmaya Mission Hospital. They didn't recommend, your. No, so it happens. Like they wherever they get a cut, wherever they get a thing, this collaboration happens, and somehow they are another. This is one thing. Second thing is they are even hesitant to send for physiotherapy.
Correct.
That is a very common when patient comes and tell, when the patient say initially when I had this problem, none of the doctors said me you have to go undergo physio. They just told me you take the painkiller, you will be all right in 2-3 days.
Correct.
When it went for 2-3 weeks, if it is not, since it is not coming down, now the doctor is telling me you go and meet a physio. So we
Correct.
feel bad. So because that it might be a very simple thing which could have been handled in a week time,
Correct.
which the patient need not suffer for 3-4 weeks. So that is a very big concern in the field of physiotherapy. Okay, if you look at that, there are many things are there. Okay, many things are there, but these are the things which are just coming to my mind. Uh, yeah.
Okay, so coming to an end, sir, I want to ask you, where do you see the future of physiotherapy in India?
See, the future of physiotherapy in India is very good and very well secured. And to my knowledge, the physiotherapist, the young generation of physiotherapists are, uh, they are, they are. I mean, not this. What should I say? The current physios, they are trying their level best to get international knowledge. To they do. One good thing is there are many international conferences, international workshops which are being conducted in India. Otherwise, the case have been maybe at 10 years or 20 years before. Such opportunities to know what is happening throughout the world. It might be through APTA, some magazines.
Correct.
Now, since the things are coming to India, many things, whether it is in the case of many field when they come and conduct workshop here, so the knowledge of the physios are becoming at international level, like how the well developed countries like Australia, Canada, New Zealand. I feel because I have personally met many physios whose knowledges are at par or much better than the physios. Because see, when I went to Kuwait to train two physios of a patient. One physio is from UK, another physio is from Kuwait itself.
Correct.
Okay. So when I was training these two physios, I could make out what that physio from UK, what he is capable of, what is his understanding about, So I could easily judge them, where he is standing. So now the physios in India are very much keen on developing their skills, learning, because the opportunities are not like that. See, initially
Correct.
maybe 10, 20 years before that, 20 years before, or that time, the opportunity to learn new things and are very less.
Very rest, yes.
Okay. So things are quite different. So the physiotherapy profession as well as the physiotherapist are very well secured. The future is very well secured. The only thing is the concerns, whatever I discussed, has to be corrected one by one. And the more, and there should be a passion for the subject, I feel. Otherwise, no. Otherwise, whoever has taken this field of physiotherapy, they may not enjoy this. Their future, they may find, okay, whether I should continue with the field physiotherapy or not. The dilemma always, when juniors comes to my field, my clinic, I always seen this dilemma, whether I should continue in the field where I can go and get some, do some course, and where I can get some good, better, some other job. I feel my future is not really secured. It's actually not true. It's basically, when I talk to them, I understand they are not really passionate about the field. They just somehow got into the field. They're just doing something, and they are not really enjoying what they are doing.
Correct.
Even though we try our level best to encourage them, give them confidence, it is not like that. Some are some people who are not really passionate, then they have a problem in the future actually. Otherwise, in general, the physiotherapy field is the best, one of the best profession what you can, one of the best profession, because it's a profession where there is a dynamicity is there. You are a clinician. You can be you can be a teacher. Here in Bangalore, there are many of the physios who have done their yoga course, or they are morning they are working as an yoga instructor. In the daytime they are working as a clinician. In the evening many of the girls morning they are working as the Pilates instructor, Zumba instructor. And they get a patients from the Zumba team. They get patients from that. Many of them are hydrotherapists. They go to they go to any places where there is a swimming pool. They introduce themselves. They get ladies for hydrotherapy. They get ladies for water, Zumba inside water.
Correct.
So here, this field is so dynamic. Once you have the knowledge of exercise physiology, once you have the knowledge of this body's dynamics, then whatever you do, it will be the best. You can be the best yoga teacher. You can be the best gym instructor. You can be the best Zumba teacher. You can be the best Pilates instructor. A physiotherapist can mold himself to anything. At the same time, he can maintain his identity. He can change his identity. And the trust of the public a Zumba instructor or to a Pilates instructor who is a physiotherapist is much more than a normal Pilates instructor.
Correct.
Because he knows the body. He has studied everything about the body. It's not about the movements he has studied. So because I myself is a yoga instructor, so when when a yoga teacher comes to me as a patient, I can talk in his language.
Correct.
You know, when he says this is the asana I do, I can talk in his language. But at the same time, I maintain the identity of a physiotherapist. This is what I am. That is why you are to me.
Correct.
That
The
is why you
profession.
came to me.
Correct.
Okay. The future is very good. The future is the physiotherapists are so dynamic. They can do anything much better than any other normal people in the healthcare industry.
Correct.
And the future of healthcare is a preventive healthcare. It's not a like whatever is currently happening is a treatment aspect. Like it's
Correct.
preventive aspect. Even what we are expecting, the patients will start coming for a screening that whether they will develop osteoarthritis, whether they will develop bad posture, whether they will develop any running injuries.
Correct.
So preventive nature of physiotherapy is also being practiced. Huge scope.
Correct. So at the end, sir, for all our audience, where they can find you and how they can connect to you.
Oh, okay. See, I'm from Bangalore. My clinic is in Indiranagar, near Indiranagar metro station. The name of the clinic is Apoorva Diagnostic and Healthcare. And my phone number is 9686613856. They can always call me and talk to me, understand what I can talk and not necessarily that they should come to my clinic, meet me directly, and if there are certain things which I can simply guide through a phone, I may guide through a phone. If there is something which required a proper evaluation, they can come and take the evaluation.
Are you available on social media, sir? Are you available on social media platforms?
I do use it because see, I have a page in Instagram, professional page, not a personal page. Professional page in Instagram. I have a professional page in Facebook. If at all I have traveled across India, if at all I have traveled outside India, the patient have contacted me through Instagram. So I went to Kuwait because the patient in Kuwait saw the patient's reviews in my Instagram. So the videos which I have uploaded in the Instagram, how I am working with the patient, he has contacted me. Recently, the contact was from Colombia, that is Latin American country.